Hospitalizations in Illinois set another record today in Will and Kankakee counties. There are just 3 ICU beds available for patients.
Hard to imagine that truth. And WGN's Dana Revick is with us tonight. Health officials say these counties are in real trouble.
It is pretty alarming. We did speak with a doctor from Amita Health. She oversees hospitals in Will and Kankakee counties. She's extremely concerned about ICU bed space. As we mentioned, it is now down to the low single digits in this region. She's concerned very soon there may not be a bed for someone who needs one.
It has waxed and waned, but it has not been this dire for such a prolonged period of time. In a very long time.
Health officials and state leaders critically concerned about hospital bed space in Illinois in the midst of a massive surge in COVID-19 cases fueled by the Omicron variant.
Across the state, we have regions where ICU bed availability, not just COVID ICU, but staffed ICU beds for other emergencies like car crashes and heart attacks and strokes, are frighteningly limited.
Right now in Illinois, there are 6,600 people hospitalized with COVID-19. More than 1,100 are in intensive care, and 42% of all ICU patients have COVID. In Kankakee and Will counties, the situation is one of the most desperate in the state.
In Region 7, there are 3 available ICU beds out of 133.
With 98% of ICU beds full, Will and Kankakee counties have the most crowded intensive care units in Illinois. The region never dipping this low on space to treat the sickest patients since the pandemic began. Only 47% of Kankakee County's residents are fully vaccinated, one of the lowest rates in the Chicago region. Will County is slightly better at 62%.
With our low vaccination rates, we did give them a window, and the variants were allowed to develop and proliferate through our communities.
Now Dr. Hill with Amita Health St. Joseph Hospital in Joliet and St. Mary's Medical Center in Kankakee says they are scrambling daily for bed space and can't rely on surrounding areas.
Unfortunately, many regions are experiencing the same thing, so there really is not an opportunity currently to transfer to other hospitals. So we have been caring for our patients as we can within our own building. If we have patients holding in the ED, we have our ICU critical care and pulmonary physicians that will go down to the ER and assess and make sure that they're cared for.
Dr. Hill says they are trying to treat and release these patients as quickly as possible from the ICU to free up beds. Right now, she says only about 20% of ICU patients are on ventilators. They are successfully and primarily using IV monoclonal antibodies. Now, another alarming statistic, 98% of people in the ICU are unvaccinated, and she says nearly 100% of patients on these ventilators are unvaccinated.
Hard to imagine. Dana, thank you.